In the year 2005, the Center for Disease Control and Prevention announced that MRSA had exceeded AIDS as a cause of death in the United States.
I want to thank everybody for your patience this morning. I'm Dale Carroll, CEO of Advantage West, a regional economic development organization based in Asheville, North Carolina. We're here on the campus of AB Tech Community College. We want to thank the community college for helping make this video conference possible this morning. We have joining us by video conference from Springfield, Missouri, Steve Woody of G3 Medical, and our guest of honor, Dr. Roger Huckfeldt. His title is Trauma Burn Research Medical Director of St. John's Research Institute, again in Springfield, Missouri. At this time, I'd like to turn the program over to Lisa Almaraz, company spokesperson for iFan Health Products. Lisa, please join us.
It is a great pleasure to see everyone here today. Thank you for coming out, being part of it, and joining us for this exciting and revolutionary product. It's the first product from iFan Health Products, and it's actually revolutionary in that it is a breakthrough in the fight against MRSA and other superbugs that have grown to epidemic rates in our country. For the first time ever, people, and especially athletes, can have the peace of mind knowing that before they get dressed for a game, they can put on Bacrobial AG with TheraWorks onto their skin, and they can have extended effectiveness in killing 99% of MRSA and other bacteria for hour after hour after hour. That's the entire duration of their competition and beyond. So it's a great peace of mind and a great service of a product to help not only athletes, but everyday people. MRSA and other superbugs have migrated out of hospitals where they first started detected first in 1968, and now some of the most deadly forms are community acquired. These lethal infections are popping up in cases all over the country, on sports teams, in universities, prisons, daycare centers, and other places where skin-to-skin contact and shared equipment are common. Bacrobial AG is now available to the public and will serve to help people from all walks of life have the security of knowing their skin can be effectively cleansed of MRSA, and better yet, is being nourished and enhanced in its ability to fight off dangerous superbugs wherever they go for many hours at a time. Please help me welcome Dr. Roger Huckfeldt. He is our Trauma and Burn Research Medical Director of St. John's Research Institute in Springfield, Missouri. He has recently conducted some very exciting tests on TheraWorks, the formula in Bacrobial AG, and joins us live this morning from Springfield, Missouri to give us his professional opinion and insight. Dr. Huckfeldt, thank you for joining us today.
Good morning from Springfield, Missouri. It's my privilege to be here this morning to share with you the platform for Bacrobial. From a historical standpoint, this product, we started looking at new and better ways to fight some of the superbugs that we see in the hospital setting several years ago. What safely could we use for addressing for our burn patients, our wound patients, as well as the trauma patients that we see on our institution? We've been doing research with various types of dressings and liquids for several years now in an attempt to find something that was effective, good for the skin, and yet cost-effective as well. I was fortunate a little over a year ago to be introduced to the platform that we have used to make these products. The platform that we now call TheraWorks was initially sent to me as a possible dressing. We took it to our lab and began to test it, and we were so excited about the results that we were sure perhaps I had done something wrong. So we sent the same product out to a private lab, and again, the results to kill the major organisms, the big superbugs that we were worried about, was overwhelming. The two biggest organisms that we were worried about were Pseudomonas and MRSA. We tested this product against both of those and found that our ability to kill those bugs was much better than anything that we had trialed so far. Based on that, we used that platform to create what we now call the TheraWorks platform. We're continuing to do work with it here at St. John's to develop a wound care protocol with it not just as a skin cleanser that we have now. So we believe that this platform has a lot of room to grow over the next several years, and we're continuing along that route. In the meantime, we realized that the ability for this platform to do what we wanted it to do was significant, not just as a dressing. We first created this product, which is a bathing system designed to be used in healthcare facilities, essentially, so that instead of using the old soap and water basin bath that you're used to seeing in hospitals, this system would be used instead. It will kill all the organisms that we know live on the skin of sick folks in the hospital, but more importantly, it lasts longer and it makes their skin feel better as compared to the soap and water. No more towels to contaminate the area. We then had the ability to turn it into a foam product that healthcare workers can use on their hands and the general public can use on their hands. Again, the benefits above and beyond what's already on the market is this has no alcohol in it. It's not alcohol or glycol based like most of the skin cleansers are. If you use an alcohol-based product, its effectiveness is through the alcohol. But as soon as that alcohol is evaporated, which happens very quickly, the killing power goes away as well. With the TheraWorks platform, the killing power stays there. We're still in the process of really identifying how many hours that is. But we know that in a collagen-based test that after 3 hours, we still had greater than 99% kill rate of both MRSA as well as the gram-negative bacteria. We've tested it against the viruses that are the most common causes of the everyday cold. We've tested it against Candida, the normal fungal problem that we see both in the healthcare world and in the public. So as we developed this, we were fortunate to be able to partner with some of the private individuals in the world, most notably today the iFan folks, in development of the same TheraWorks platform, but in a vehicle that could be then used by the sports world. Anybody that has read a newspaper or watched a news show within the past several months has seen multiple occasions where MRSA has shut down professional sports teams. It's taken young, healthy athletes and caused significant infections for them, sometimes leading to death in some places. If you think what happens in the athletic world, there's no way that you can compete in a sport without coming in contact with somebody else, with their sweat, with their clothing. And so that's where those organisms are transferred. So our goal was to develop a product that you can use on your skin, that lasts a long time, and that we know from our lab studies kills all those superbugs, the bad organisms, and yet at the end of the day is good for your skin. When we first came out with our foamers, I wandered around using it throughout the day here in the hospital setting, and was surprised at the amount of people that came back saying, can I have more? Because it makes your skin feel good, unlike the alcohol-based products. So we're excited about our opportunity with iFan and the Bacrobial AG product itself to be able to get it out into the public, more than just using it in the hospital. Here at Mercy, we're starting to use the bathing system within our ICUs within the next week or so. And so if you were a patient here, this is how you would get your bed bath if you're in that super high-risk group of patients. So again, the ability to partner with the outside world and to get this just outside of our hospital walls is a real exciting thing for us as well.
Thank you very much, Dr. Huckfeldt. I'd like to open the floor up for any questions for Dr. Huckfeldt.